Here now, Dr. Greg Horner of Tri-Valley Orthopaedic, Dr. James Chen with San Francisco Sports Medicine as they discuss Watt's future in this week's Second Opinion. Gentlemen.
All right, so J.J. Watt has sustained an incredibly devastating injury, ending his season, potentially jeopardizing his career based on what the diagnosis actually is. So I brought Dr. Chen on as a second opinion as to what could be going on with his knee. We know it's a tibial plateau fracture. Here's the injury mechanism. He tripped catching his feet together, landing with incredible force given the size of this guy and his incredible strength. When the knee contracts maximally to reverse the force of falling, that force can exceed 10 to 20 times body weight per square inch. So the force is not surprisingly enough to fracture the bone. His injury breaks down into two categories. It's a tibial plateau fracture. It can be the medial or lateral tibial plateau. The lateral, meaning the outside, is where, honestly, he would have the best diagnosis, and it turned out it is the lateral side. Now, after we decide which side it is, the type of fracture it is makes a big difference. Is it a split, or is it a comminuted or depressed type fracture? So Dr. Chen has a great example of a split. Why don't you talk a little bit about this that you treated?
So the tibial plateau is the weight-bearing surface of the knee, and it's covered with smooth cartilage. And I use a camera and look inside first. And this view here shows me going over with a probe this step off and this uneven surface. And so you need that cartilage to be lined up perfectly so you have longevity of your knee.
But this is a perfect split, right? So
exactly. It's a simple, perfect split. After I fixate and manipulate the fracture, I then look inside and you can see this end of this clip here. It's a nice smooth surface. In the end, what it looks like is this. So there's a plate holding the fracture together, and as long as you see this nice smooth surface here that's restored, such as in the arthroscopic view, then he shouldn't have any issues. This takes about 2 months to heal, 1 month of rehab. If he had a simple split and it was fixed in this manner, I don't think he'll have any residual problems. He's definitely out this season, but no residual issues to his career, in my opinion.
Okay, so a simple split, he can get back. Full activity, no problems at all next year would be expected. However, if it is a comminuted fracture, meaning one that is kind of bashed in multiple pieces, it is much more difficult to get the pieces back into what we call anatomic alignment. And it will require bone graft and much more aggressive treatment, and it is almost impossible to make it perfect. So without knowing the diagnosis, we can't know exactly what's going to happen. But by what we're hearing is that it is a lateral tibial plateau fracture. It is a simple split, and he should be able to get back to full activity.